Skincare is a very common problem that can sometimes turn lethal. In this video, I'll cover a few celebrity cases of skin cancer, discuss the type of skin cancer that affected that individual, what were the outcomes, and what are some highlights to notice about that specific cancer. Before we get started, don't forget to smash that subscribe button. Also, don't forget to share and like this video. Now let's get going. So the story of Bob Marley and his skin cancer related death is well known. Bob Marley noticed a lesion on one of his toes that he thought was related to a soccer injury, ignoring it for a while, finally going to seek help with a dermatologist, getting a biopsy of the lesion, and finding out to his dismay that this was actually skin cancer and not a soccer injury. The specific type of cancer that Bob Marley suffered from was what we call acral malignant melanoma, which is more common in people of African descent and is more common on areas like the palms, the feet, the nails included, and sometimes in the oral cavity. Marley ended up dying of complications related to metastatic melanoma after reportedly having opted for more conservative treatment options. The details of the story are not clear enough to decide whether Marley's choice of opting for a more conservative treatment had anything to do with his untimely death. That being said, acral melanoma is something to pay attention to and notice, so be sure to examine those palms and the bottom of the feet and look for nail changes that are persistent. Bring them to the attention of your dermatologist and figure out what's going on. Don't let things slip by the wayside. Character actor James Rebhorn was diagnosed with melanoma back in 1992 and passed away from complications of metastatic melanoma in 2014. Now, this is obviously a very long battle with cancer, and what many don't realize is that cancers like melanoma can take years or even decades to metastasize and infiltrate other areas and other organs in the body, eventually leading to death. In fact, there are many cases of melanoma where the original tumor was removed, not seen or noticed for years, and eventually turning up as multiple metastases in different organs, leading to a quick death decades after the original lesion was discovered. With that in mind, it's important to go to regular checkups with your doctors, your dermatologist, and your primary care physician or your internist. General wellness checks can help screen for skin cancer first and foremost, not to mention for metastatic disease that can be caught early. Stephen J. Cannell, who was a highly prolific TV writer and producer, died of complications related to metastatic melanoma in his Pasadena home in 2010. While most cases of melanoma are actually not lethal, regular skin checks and general well checks with your primary care physician or your internist can keep things in check and detect skin cancers early, which is extremely important, especially with the more deadly ones such as metastatic melanoma. Jimmy Buffett died in late 2023 from complications arising from metastatic Merkel cell carcinoma, which is a rare type of skin cancer appearing as a painless reddish, pinkish, or skin-colored pimple or bump later in life. Jimmy Buffett's death helped raise awareness to Merkel cell carcinoma, which is actually a very rare type of cancer, but that discussion has significance in the sense that not all skin cancers are melanomas. Many skin cancers can present as pimples that don't go away or ulcers that don't go away for weeks or even months, and those skin lesions require you to seek professional help with either your dermatologist or your primary care physician, who will likely refer you to a dermatologist to establish the diagnosis and take care of it in the best way possible. Actor Hugh Jackman has had several cases of basal cell carcinoma and is famous for those facial surgeries. Basal cell carcinoma is the most common type of skin cancer and usually shows up as what we call a pearly papule or ulcer. Papule is a small bump. The ulcer is an area where the skin is broken open, crusty or bleeding periodically. And while being the most common type of skin cancer, basal cell carcinoma is usually the least harmful and can be readily cured by either local destruction or local surgery, which means that early detection can actually be very valuable because you will end up with a smaller area of treatment, sparing you complications arising from the treatment, and not to belittle the fact that you could end up with a smaller scar over the treatment area. So basal cell is mostly a nuisance, but could be a very serious nuisance, resulting in many surgeries and ultimately possible complications. Not a fun prospect. So be mindful to go to your dermatologist regularly, screen for those skin cancers, basal cell squamous cells, melanomas, or even Merkel cell carcinomas. Make sure you're on top of things and stay ahead of the curve and treat those cancers early. If you've enjoyed this video, don't forget to smash that subscribe button. Also, don't forget to share and like this video. For more information about early detection of skin cancer, pick up my book, Sick Skin, Skincare Made Simple on Amazon.com. Now available in audio. Thanks for watching. God bless.